Welcome to the Daily Debrief, where we take a look at today's big story. I'm Jordan Gartner, and we are speaking to reporter Sean Delancey. Sean is covering an assembly bill that is up for debate in Carson City that could possibly lower health insurance premiums. Sean, please explain a little more on what's up for debate.
Yeah, Jordan, this one is really interesting. Welcome back to my news car. Essentially, what we're covering today is a bill called SB 420, and it gets a little bit in the weeds because it does involve health insurance premiums, very complicated, and it does a whole lot of other things with Medicaid. But the thing that a lot of people that it's causing controversy here is the meat of the bill, and what it does is it's attempting to lower health insurance premiums across the board by about 15% over 4 years, and it's doing that by forcing any insurer who wants to opt into offering Medicaid plans, state plans essentially, it's forcing them to create what they're calling a public option plan. And that is supposed to be 5% cheaper than some of the lower end plans that are already offered out there. And that's to kind of put pressure on your private insurers and other businesses to lower all of their other premiums, and that could take time. But that's essentially what the bill's trying to do.
And how did you first start following this topic?
Well, we're getting into the almost 0 hour of the Nevada Legislature. It's over at the end of the month, so I've been pretty much living on the bill tracker website called Nellis. And this one was introduced very, very late in the session here. Its first hearing was the 4th on Tuesday, and there's another hearing today. But I've had my eye on this one a little bit since it was introduced very late in the session, and it got a lot of heat during that public hearing, both from people who want it to pass and lower these health insurance premiums for everybody, and then a lot of people who opposed it, from the healthcare industry to chambers of commerce.
And it looks like you've already touched on, of course, a little bit about the pros and cons of what you're hearing, but anything more you wanted to share with that? Kind of what are the positives, what are the negatives that you're hearing about this bill?
Yeah, so I mean, it really comes down to how the bill would work in practice. If it does what it's supposed to do, there's about 350,000 Nevadans who do not have health insurance, one of the highest rates in the country. And what it's trying to do is seek out those 350,000 uninsured people and bring them into the system by providing a more affordable option for them to buy into the system. Hopefully, that would allow more people to have health insurance so they don't end up costing the system more when they need to make emergency visits, things along those lines. They can get healthcare early. But the opponents are saying that it could potentially do the exact opposite by driving insurers out of the public exchange, essentially. Like, I don't want to deal with this. I don't want to offer this. So I'm just going to get out of the Medicaid system altogether. And that it also might drive doctors out of the system. There might not be as much money, which would lower access to care, and then it wouldn't do anything to the costs for these insurers. So that might just shift those costs to other areas, private insurance, for example, raising insurance for everybody else. So it's a sticky situation. It'll all come down to how this bill works in practice if it passes.
And when it comes to the bill passing, when is a time range? When can when can we expect a decision?
That one's up in the air. Again, the legislature is done at the end of this month, so it has to be passed or it dies by the final day of this month. But it has another hearing in Health and Human Services today. We'll see if they take action on it there. But even if it passes Health and Human Services, where they're trying to figure out how this would actually work to curtail insurance premiums that have risen for years, even if it passes there, it's going to have to go to the Finance Committee. And the Finance Committee is going to figure out the actual dollars and cents of it. Right now, it's expected to cost at least $73 million over the course of one biennium, 2 years, and then raise in price by about $30 million in the next 2 years. And so there's a long process for it to go through, because even once it leaves the Senate, it would have to go through the Assembly and then be signed by the governor. So it's got a long way to go in a very short amount of time.
All right. And my very last question is going to be, who would it actually most affect? Is it everybody in Nevada? Is it just people who are going to be trying to search for new insurance plans? Kind of, I guess, who is it going to be most affecting here?
Yeah, that one's actually a two-part answer, because it's short-term and long-term. If it comes into passing, then it would start taking effect in 2026 is when it would actually be implemented into law. At that point, that's when these people who are uninsured would have access to these public option plans, and they would be the first ones to be affected. But again, if this works, if the pressure on these businesses works the way that the Democratic leadership expects it to, then over the course of time, it could potentially lower all health insurance premiums for everybody by about 15%. So short term, the uninsured; long term, potentially everybody.